Thank you so much for joining us today. What we have is a joint Asian Stroke Symposium between UCSF Health, the Neurology Department, and the Chinese Hospital of San Francisco. We have so much information, we couldn't do it all at one place. So we have 3 parts to this symposium. Today is the first part, and then we have 2 more parts coming up. Hello 各位，多謝你嚟參加我哋今日呢個講座。咁咧就係呢個係一個網上嘅亞裔中風嘅講座啦。就總共有3個部分嘅。咁我哋今日係做第一個部分。呢個講座咧係由加州大學舊金山分校嘅腦科啦，同埋東華醫院一齊合作舉辦嘅項目嚟嘅。So 咁呢個咧就係今日嘅項目啦。咁咧就係有3位醫生同我哋講呢個今日嘅行程嘅，咁咧就係由 Dr. Kim 啦、Lindsay Carey 呢個護士啦，同埋呢個 Catherine 孫醫生、孫麗珠醫生。咁咧我哋今日講咧就係初第一部分咧就係先講咧就係乜嘢叫做中風，有幾多類型嘅中風，同埋咧我哋點樣先至中風嘅，有咩症狀咧，同埋有咩嘢係一啲高風險嘅因素會我哋可以控制到，係可以預防中風嘅咁。咁然後咧最尾咧就係講呢個問答同埋做一Dr. Kim 會做個總結嘅。So this is the agenda for today, as you can see on the screen. And so we'll go through each part of it. We have 3 speakers today, and Dr. Anthony Kim, Lindsay Carey, and Dr. Catherine Suen. And so without further ado, I'm going to turn this over to Dr. Kim, who is the Associate Director of our Neurology Department and the Director of the UCSF Comprehensive Stroke Center.
Thank you so much for the kind introduction. Again, my name is Anthony Kim. I'm a stroke specialist here at UCSF. I direct the Comprehensive Stroke Center at UCSF, and I'm really pleased to be part of this outreach to the Chinese community and the Asian community in San Francisco, and also to be involved in this partnership between UCSF and Chinese Hospital, where we are working on stroke center certification at Chinese Hospital as well. We have a couple of great speakers this afternoon, and I think the information that we'll go over is going to be very helpful and important to understanding stroke and how we can best prevent and treat and recover from stroke.
咁金醫生咧，金醫生係韓國人嚟嘅嚇，咁佢咧就即係講就今日我哋會有一啲非常之好嘅講員啦，同你哋係講呢個關於中風嘅題目嘅。咁咧呢個咧亦都係我哋同東華醫院合作嘅項目。咁佢咧就係我哋呢個加州大學嘅呢個全方位中風嘅中心嘅主任啦，咁佢亦都係幫緊東華醫院咧，係得到佢哋呢個中風嘅認證嘅。
And with that, I'll turn it over to Lindsay to go over the definition of what a stroke is and the types of stroke, as well as identifying signs and symptoms of stroke and taking action.
咁佢介紹我哋呢個護士，呢個係Lindsay Carey， 咁咧佢咧就會同我哋講有中風嘅定義啦，同埋有咩型中風啦，咩治療方法啦，同埋咩症狀嚇。
Hello, my name is Lindsay Carey. I'm the Stroke Navigator at UCSF. Thank you, Dr. Kim, for that introduction, and thank you, Diana and Chinese Hospital, for inviting us to come speak with you today. So in this particular section, our objectives are to describe and understand the different types of stroke, and then to understand the different types of treatment for each type of stroke.
咁Lindsay咧就係話佢好多謝今日係有呢個機會嚟到喺呢個同東華醫院合作嘅項目嗰度嚟到同你哋講關於 stroke 嘅嘢啦。咁佢今日咧就會同你哋講述不同型嘅中風啦，同埋乜嘢嘅中風啦，同埋中風嘅治療方法嘅。
But first, we'll start with some stroke statistics in the United States. So stroke is the 5th leading cause of death in the U.S., and it is also the leading cause of serious long-term disability. More than 795,000 people a year in the U.S. suffer from a stroke, And that means every 40 seconds, someone has a stroke, and every 4 minutes, someone dies from a stroke.
咁啊，各位睇到個幕上面嗰啲字啦，就係呢個係中風嗰啲統計嘅數字嚟嘅，好表面嘅數字。咁咧，中風咧就係美國第5個大嘅死亡原因。咁咧，佢亦都係導致呢個嚴重長期殘疾嘅主要嘅原因。咁啊，美國而家暫時嚟講咧，有成80萬嘅人咧係有中風嘅。咁啊，每40秒咧就有一個人中風噶啦，咁係非常之多人中風嚇。咁咧美國咧就仲有唔止係每40秒一個人中風，係每4分鐘咧就有一個人咧係因為中風而死亡嘅。
Okay. So there are 2 types of strokes. The first is an ischemic stroke, and the second type is a hemorrhagic stroke.
咁咧就有2種中風嘅類型嘅，一個咧就係缺血性嘅類型啦，一個咧就係出血性，一個就唔夠血，一個咧就係爆血管。
So the ischemic stroke, it occurs when there's a blockage in an artery in the brain that can be caused by a blood clot.
咁咧呢個缺血性嘅類型咧，即係嗰條血管塞咗啦，係嘛？咁咧就喺個大腦裏邊都有好多血管噶嘛，咁咧就其中一啲動脈嘅血管咧係塞咗嘅，就引成呢個缺血性嘅中風啦。
The second type, the hemorrhagic stroke, occurs when there's bleeding into the brain when a blood vessel bursts or ruptures. 咁
呢個出血性嘅咧，出血就即係爆血管啦，咁就係其中一條血管嗰度咧就有個窿。或者係有一部分咧係個血管咧嗰個牆咧係薄咗嘅，咁咧嗰啲血咧就喺嗰度飆咗出嚟，咁咧就引致個腦裏邊有積血，咁呢個就係出血性嘅中風。
So looking at the 2 different types, we want to know what type of stroke is more common. And so ischemic stroke make up the majority of the strokes in the United States. It's about 87%. And then the hemorrhagic strokes are about 13% of the strokes in the US.
咁咧喺美國嚟講咧，係邊種型嘅中風係比較常見咧？就係缺血性嘅，即係多數係啲血管塞咗，係唔夠血。咁咧就係有7%嘅人咧係中風嘅人士咧係有呢個缺血性嘅。咁另外嗰個咧就剩翻1/3嗰啲中風嘅人士咧就係因為出血性嘅中風而有時嘅。
And then there's a third type, what we call a trans-ischemic attack. A TIA is sometimes called like a mini stroke or a warning stroke. The symptoms of this last only for a short time, so it could last for a couple of minutes, with symptoms typically resolving in 24 hours. A TIA can be followed by a full stroke. So it's important to seek medical attention immediately and to call 911.
咁 TIA 咧就係 transient， 即係短暫性啦。ischemic 就係缺血啦。attack，OK，呢個咁嘅短暫性嘅腦缺血嘅發作嘅情形咧，有時咧就叫做小中風或者係警告性嘅中風，即係 warning。warning 嘅意思咧，即係話嗰啲中風嘅症狀咧就唔會長久喺度嘅，暫時就只係出現俾你知道咗你有問題喎，就然後咧嗰個症狀咧就會冇咗嘅。咁咧呢個就係問題啦。咁咧因為個症狀出一段短嘅時間啦，而跟住又冇咗咧，咁好多人咧都不以為意嘅。咁咧就好多時候唔去睇醫生啦。就算去到睇醫生嘅時候咧，佢都要話冇事啦，冇事可以翻屋企啦咁。咁咧，但係如果係有呢個咁嘅症狀，就算佢係冇咗之後咧，你都應該係要打911去醫院嗰度睇一睇嘅，去查一查嘅。
Now that we'll kind of go into the stroke treatment for ischemic strokes, there's 2 different treatment options. You have IV TPA or alteplase, and you also have a mechanical thrombectomy.
咁如果係條血管塞咗嘅時候咧，我哋係有2個方法嘅，一個咧就係用藥，一個咧就係用手術。用藥嗰個咧就係用啲溶血塊嘅藥啦。咁如果係做手術咧，就係要抽咗嗰嚿 入去個腦嗰條血管嗰度抽咗嗰嚿血柱出嚟。
So IV TPA or alteplase is a thrombolytic used to treat acute ischemic stroke by breaking up the clot. This medication is time sensitive, so if you're eligible, the medication may only be given within 4.5 hours of last seen normal. So it's really important that if you suspect you're having a stroke, to call 911 so that you can get to the hospital in a timely manner.
呢個就係我哋講嘅黃金時間，係俾藥咧，同埋我哋同你做啲乜嘢嘅手術咧，係有一個黃金時間嘅。過咗呢個時間咧，就係做唔到嘅。咁咧，呢個俾藥呢個溶血劑啊，有時叫做 alteplase 個藥名咧。咁咧就佢係要喺最後發覺你係正常嘅時候咧，離開呢個病發嘅時候咧，係唔多過4.5個鐘，4個半鐘頭嘅。即係話，如果過咗4個半鐘頭嘅時候咧，係我哋就唔可以俾食藥嚟㗎啦，因為佢冇效啊，唔係唔可以俾，係俾咗都冇用啊，佢用唔到個肺血塊，因為太過實啦已經。所以咧，你如果係有症狀嘅時候咧，一出現症狀嘅時候咧，你就唔好等話等啲仔女翻嚟啊乜乜乜啊先至去，你就即係打911，911你係可以用中文講你話 Chinese。或者係 Korean 或者係 Japanese， 你用乜嘢語言都好啦，你淨係識嗰個字就得㗎啦。你講咗咧，嗰啲人就會同你駁線去嗰啲翻譯員嗰度，就會你就可以講用翻你嘅語言講翻你想講嘅嘢嘅。所以打911嚇。
The other intervention is called a mechanical thrombectomy, and this is a procedure that happens in neurointerventional radiology, and it helps to remove blood clots from the brain after an ischemic stroke. So a catheter is inserted into your femoral artery, which is in your groin, and it travels up to the neck and or into the brain until it reaches the clot. And it has like a little claw on it that opens and retrieves the clot, and blood flow can be restored to that area of the brain.
咁咧呢個切除術咧，即係攞翻嗰個血傳出嚟嘅手術咧，就係喺個髀罅嗰度咧，你有血管噶嘛，咁就喺嗰度插條管入去，就一路通上去嗰條頸啦，又跟住通入個腦嗰度啦，咁所以係條幾長嘅路嚟嘅。咁咧通常都係由嗰啲放射部門嗰度做嘅，因為放射部門嗰度可以睇到佢條管點樣跟住嗰條血管咁樣走啊嘛，就幫啲醫生知道嗰條路點樣行嘅。咁咧就去到個腦嗰度揾到嗰嚿塞咗血管嘅地方，就將嗰個血塊就將佢掹走咗，就帶走咗出嚟，成嚿血塊攞走嘅。所以你睇到嗰幅圖仔咧，呢幅圖仔呢度咧，呢個咧就係攞咗出嚟嘅血塊啦，就係呢條管咁樣掹咗佢出嚟嘅，好神奇啊！
All right, and so for hemorrhagic strokes, there are a couple of different treatments. For the subarachnoid hemorrhage, this is bleeding in the subarachnoid space, and it's caused typically by a brain aneurysm. And an aneurysm is a ballooning of an artery in the brain that can rupture and bleed into the brain. And so the aneurysm may be coiled or clipped to secure the vessel, and that's also done in the neurointerventional radiology suite.
咁呢個出血性嘅中風咧，喺唐人嗰度咧係比較多啲嘅，即係佢話普通嚟講就係13% 啦，但係喺唐人嗰度咧係多過13% 嘅喺中風嗰啲人之中啊。咁咧佢呢個嘅做法咧都係一樣嘅，都係喺個髀罅嗰度插條管入去，然後跟住上咗嗰條頸，跟住入咗個腦，去到嗰個位咧，佢之所以出血咧，就係因為依度嗰個血管。佢咧就係爆咗嚿嘢出嚟咧，就係因為個血管嗰個外牆啊薄咗啊，或者中間個外牆咧，外牆有3層嘅，佢可能中間嗰度裂咗，咁佢有啲血咧就走咗入去中間嗰度，嗰個外牆嘅中間嗰度，咁咧就突咗一嚿出嚟，呢度咧全部都係血嚟嘅。咁佢有2個方法做嘅，一個咧就係喺呢度用條線啦嚇，咁咧就將佢喺呢個頸位咧就綁住咗佢，綁住咗佢嘅時候咧。如果呢嚿嘢穿咗嘅時候咧，因為佢呢度綁住咗啦嘛，咁其他嗰啲血管咧都唔會影響到，都唔會爆血管咯。 所謂爆血管就係呢度咁爆咗。咁咧，所以咧呢個綁住條頸呢個係一個方法嚟嘅。另外一個方法咧就係將佢入咗去嘅時候咧，將佢塞住咗佢，即係你搏啊嘛，咁我塞住咗你，咁嗰度咪嗰啲血就算係呢度爆咗啊，咁我呢度頂住咗啦，咁就即係唔會有出血嘅大陣仗啦，係嘛？咁所以咧呢兩個咧就係一個方法嚟，都係用呢個一條導管入去咁樣做出嚟嘅。
So now that we know what the different types of strokes are, the next step is to know if you're having one. So our objective is to know the signs and symptoms of a stroke, and that if you see these signs of a stroke, to call 911.
咁咧，所以咧，我哋嘅目的咧就係要大家知道第一件事就係你要知道你係中緊風咯。如果你唔知道你係中風嘅，你又唔識打電，你又唔會去打電話，咁我哋幫唔到你。你一定係要入到嚟醫院，我哋先可以幫到你，係咪？
So signs and symptoms of a stroke, recognizing a stroke, we use the acronym BFAST as an acronym for stroke symptoms.
咁咧，呢個 BFAST 咧 ，BEFAST 呢幾個字咧，係每個字咧都係一個動作嘅簡寫嚟嘅。所以呢個中文咧就係睇到啦 ，B 就係代表平衡 ，E 就係代表隻眼 ，F 咧就代表塊面，個 A 咧就代表隻手啱啊嘛 ，S 咧就 speech 講嘢，咁啊 time 咧就 T 就係 time 時間 ，OK， 咁咧即係我哋係要睇咩症狀咧？睇下平唔平衡啦，隻眼啦、面啦、手臂啦、講嘢啦，同埋咧就要第一時間咧就要打911。
Right, so the B in BFAST is for balance deficits. This is a sudden onset of trouble walking, dizziness, loss of balance, or not being able to, walk in a straight line.
咁咧呢個咧 B 咧就係代表 balance 平衡啦。即係我哋嘅平衡失調嘅中風嘅人咧，係可能會出現平衡失調嘅症狀，係點咧？行路覺得有困難啦，覺得有啲頭暈啦，行路擺下好容易跌親啦，失去個平衡啦咁。呢個就係平衡嘅問題嚇，係喺行路嗰度睇到嘅，通常同埋覺得頭暈眼花嘅。
The E stands for eye disturbances. So this would be a sudden onset of blurry vision, or difficulty seeing out of one or both eyes. It could also be double vision, or a loss of vision where you can't see peripherally, or you kind of had a field cut where you can only see like half of what's in front of you.
咁呢個眼部嘅障礙咧，E就即係眼啦，係咪？眼部嘅障礙咧係可以好多時係一邊嘅，係一邊一隻眼有問題嘅。可以睇唔到嘢啦，可以睇嘢好模糊不清啦，或者睇到雙影啊，即係有兩個影嘅，或者咧直情係即係覺得係直情係睇唔到嘅，突然間佢好似盲咗咁樣一隻眼。咁所以咧呢個咧就係中風嘅症狀啦。最突出嘅地方咧就係佢通常都係單邊嘅，一隻眼嘅，唔係兩隻眼一齊咁樣嘅。所以大家留意，逢親係單邊嘅嘢咧，大家都要小心啊嚇。
So F is for face, and this is a sudden onset of a facial droop or facial weakness. It could also be drooling from one side of the mouth. And a good way to see if there's a facial droop is to ask the person to smile to see if they are able to, bring both sides of the mouth up. The other thing to keep in mind is that we wear masks nowadays, so this particular symptom might be difficult to spot.
That's a really good point. 咁咧 F 咧到 F 嘅字咧就代表面部啦。咁咧個面部咧，你知咧，如果我哋唔笑嘅時候咧，有時咁個面咧都係拉長咗，都可能係右邊嗰個面咁嘅款喎，兩邊面都係咁嘅款，都係拉長塊面係咪？所以咧，我哋要做嗰個要叫個病人做一樣嘢，就係叫佢笑。笑嘅時候咧，嗰個面咧就會戚起啦。但係如果一邊面戚唔起，得一邊面戚起嘅咧，咁呢個就係問題嚟啦。咁同時咧，我哋有時咧可能見到佢嘴角嗰度咧，可能一邊嘴角流口水，因為佢冇咗個肌肉控制啊。咁嗰啲口水咧就唔識自己吞翻喺嗰邊嘅口腔嗰裏邊吞翻落個喉嚨嗰度，咁咧就會流出嚟啦。咁所以咧，但係我哋而家 因為戴住口罩啊嘛，戴住口罩冚住個鼻以下嘅口，咁啊半邊面睇唔到咯。所以咧可能即係你要做呢樣檢查嘅時候咧，就係要除咗個口罩。你自己覺得自己有問題，你都可以企喺個鏡面前㗎，除咗個口罩佢，對住個鏡自己去笑，咁啊睇下係咪好似而家咁嘅款啦，就係一邊面就係就係落咗嚟嘅，即係笑唔喐嘅呢邊面梗咗咁嘅，咁另外一邊面咧就笑就即係平時咁樣見到笑個樣啦，隻眼都笑埋啦，係咪唔知個面啦？咁所以咧，大家係可以自己喺個鏡面前咁樣做嘅，就算屋企冇人啊，你都可以自己做去 check 下係咪可能有中風啊咁嘅。
A stands for arm weakness, but this could also be leg weakness. And this is a sudden onset of arm or leg weakness or the inability to move on one side of the body. This also includes numbness on one side of the body. And a good way to test this is to ask the person to raise both arms. Are they able to move the arm or leg that's affected? And does one drift downward when you ask them to raise it?
咁咧 A 咧就係講隻手啦，OK， 就係講個手臂咧，又係單邊嘅喎，即係我話總之係一邊唔妥嘅嘢咧，就係同呢個中風好有關係嘅，係你哋係要特別留心嘅。咁咧佢呢個咧就係隻手啦 ，OK， 咁如果係各位朋友或者有家人喺屋企咧，覺得佢唔係幾妥咧，你可以叫佢將兩隻手舉起，舉到大概膊頭咁嘅位啊。咁你咧就可以叫佢眯埋眼添嘅，咩？佢舉到膊頭嗰位咧，佢一隻手咧，佢就會自己，佢舉唔得起嘅，佢咧就會自動咁樣就會跌低咗噶啦。咁所以咧，呢個就其中一個情況啦。另外一個情況咧就係一邊隻手麻痹冇力，咁佢通常又係一邊喎。咁呢啲咁嘅情形咧，就係同隻手有關係咧，都係中風嘅症狀嘅好明顯嘅一個地方嚟嘅。
The S stands for speech, and this is a sudden onset of difficulty speaking, slurring your words. If you're unable to speak or say simple items that you are used to using every day, like pen or cup, that could be a sign of a stroke as well.
咁咧 S 咧就係代表 speech， 即係講嘢啦。咁講嘢咧，中風嘅病人咧係會有啲困難嘅。佢可能想講唔出口，或者講出嚟嘅時候咧，嗰啲字一嚿嚿咁唔清楚嘅，或者咧就係唔清楚，佢仲詞不達意嘅，講出嚟啲嘢咧，佢係講唔到自己想講嘅意思嘅。咁咪有啲就直情連出聲都出唔到咁啦，嚴重啲嘅就咁，所以咧係有不同嘅症狀嘅。總之你覺得係有啲唔妥，同佢傾開偈，佢好似語無倫次咁樣答啲嘢係唔妥嘅，或者係講啲嘢出嚟好似咧聲，你成日要話吓你講咩話？我聽唔到喎，你講咩話？你要咁講得幾次嘅時候咧，你就要懷疑下呢個人係咪有中風嘅問題咧？係咪言語不清咧？
Right, and then lastly, T stands for time, and that means it's time to call 911 if you experience any of those symptoms. The faster that EMS arrives and gets you to the hospital, the better the chances of survival and decreased disability. It's going to be important to tell EMS the time of last normal. So try to determine the last time that the person, try to determine the time that the person was last seen without any stroke-like symptoms.
咁你 T 咧就代表 time 咧，即係時間啦。咁咧時間咧即係要你及時行動啊。如果你有懷疑嘅時候咧，你就打911，唔好怕醜，唔好怕嗰啲救傷車 VV 聲咁嚟到，俾隔離左右聽到，自己感到即係唔好意思。唔好意思呢個字咧，其實可以好累人嘅，因為你唔好意思咧，有好多嘢唔做咧，就累咗自己，唔得去得醫院唔夠快。咁咧呢個時間咧係點樣決定咧？就係你好多時咧，佢哋會問你你話你隻手而家遞唔起啊，或者你塊面歪咗啊，或者你隻眼蒙查查，或者你講嘢唔清楚。總之你任何嘅症狀都好啦，任何嗰啲症狀都係可能係中風嘅症狀嚟噶嘛。咁咧佢就會問你，佢話咁你之前咧係幾耐之前你發覺開始有咁嘅症狀嘅？即係 正常嘅時候係到幾時？譬如我食飯嘅時候，我都冇話一邊面咁歪咗落嚟流口水嘅。OK，咁我知道12點嘅時候我都係OK 嘅喎。咁你幾時開始流口水㗎？可能1個鐘頭前咧咁呢個咧就可能中風嘅時候咧就1個鐘頭之前開始咧。就係你講你咩症狀，關於你嘅咩症狀，就係嗰個症狀未出現之前個正常嘅時候，最後你記得係幾時咧？所以係非常之重要嘅。呢個時間咧就係決定有乜嘢嘅治療方法可以做或者唔可以做。
Thank you so much for letting me present, and I'm going to hand it over to Dr. Suen.
Thank you, Lindsay。我哋好多謝 Lindsay 嚇，佢講佢嗰啲嗰啲 slide 做得好清楚，大家可以睇到一目了然。Thank you. So, Dr. Suen, without further ado, so you are a resident now at UCSF, right?
Correct. Yes, I'm a second-year neurology resident training at UCSF.
How many more years to go?
2 more years.
Wow, 4 years total?
Mm-hmm.
Wow. 所以做一個腦科醫生嘅訓練都非常之漫長㗎，佢係總共要訓練4年嘅。而家孫醫生做咗2年，仲有2年咧。
I'll be discussing the stroke risk factors and prevention. And anyone can have a stroke at any age, but typically we think that, 60 years and older. However, certain risk factors increase the likelihood of stroke, which I'll talk about today.
咁孫醫生話咧中風咧係任何年紀都會出現嘅，但係如果係60歲以上嗰啲，如果有呢啲咁嘅危險因素咧，個中風嘅情況係會多常見啲。
So for ischemic stroke, which Lindsay was able to talk to us a little bit more about, to start out with risk factors. So high blood pressure can damage the brain's blood vessels. We also think about high cholesterol causing a buildup of plaque inside these blood vessels, which can block blood flow to the brain. We also list diabetes and having high blood sugar causing damage to the blood vessels as well. I'll also mention that there's an abnormal heart rhythm, which I'll talk about in the next slide, that can also increase your risk of stroke. And specifically, other structural heart problems, such as valve disease or heart failure, can increase your chance of having a blood clot form in the heart and then travel to the brain to cause blockage of oxygen as well. Next, we have tobacco use. This also increases plaque buildup in your blood vessels, which causes the blockage of oxygen. Smoking can also increase your blood pressure, which, as we talked about, is another risk factor for ischemic stroke. I also list drug use just because more commonly cocaine and meth use can injure the blood vessels and accelerate plaque buildup and increase your blood pressure, and also causing irritation to the blood vessels as well. Physical inactivity, so the lack of exercise, is also significant as a cause for ischemic stroke. And then ultimately, obesity leads to other medical problems such as diabetes, hypertension, cholesterol problems, all of these various risk factors that I listed above.
So let me ask you, if you were to break down these risk factors into risk factors for ischemic stroke as well as risk factors for hemorrhagic stroke, which ones are for hemorrhagic stroke?
I'll talk about the hemorrhagic stroke ones next, but for all of these, they can all contribute to ischemic stroke.
咁呢個咧就係呢個缺血性中風嘅，呢度全部嘅風險咧因素咧。大部分咧都係可以引致缺血性中風嘅，咁咧佢陣間咧就會講出血性中風嘅危險因素係分開嘅。咁有咩咧？咁你大家睇到㗎啦，就係高血壓啦、糖尿病啦、高膽固醇啦，個心跳唔正常就係嗰個心房震動啊唔正常，或者係個心臟裏邊結構食煙啊、吸毒啊、唔做運動同埋肥咧、脂肥咧。
Aspect as a risk factor for ischemic stroke that I wanted to mention also is this abnormal heart rhythm called atrial fibrillation. So as you can see down here in the red lines over here, rather than a normal paced heart, as you can see, atrial fibrillation is when your heart rate is beating irregularly, it's faster than anticipated, and it doesn't beat as expected. And this can actually cause a blood clot to form in the heart, travel up the blood vessels into the brain, and this can actually cause a blockage and a stroke. So usually for some of these patients, they'll get started on blood thinners to prevent the clots from forming, to reduce the stroke risk. And so it's important if you have a diagnosis of atrial fibrillation to talk to your primary care doctor about ways to reduce stroke risk.
咁呢個心房震動咧係一個非常常見喺中風病人嘅危險因素嚟嘅。佢係點咧？本來我哋嘅心係好正常咁樣一跳兩跳三跳，每一跳都係好正常、好有規律咁樣跳噶嘛。但係咧佢咧個心臟裏邊咧突然間出咗一啲跳動嘅電流問題，咁於是咧佢就唔係咁樣正常咁樣1、2、3、4咁樣跳啦，佢咧就噔。或者係又停一停，原來你睇到個心跳嗰個速度咧，佢唔係咁正常咁樣去跳嘅，佢係有時快，跟住有時慢，跟住又快啲，跟住又慢。咁佢有快有慢嘅速度咧，就會點咧？形成咧個血咧喺呢個心臟裏邊咧，佢唔得正常咁一下一下咁樣跳，咁樣泵啲血出去。當佢長嘅時候啊，有啲時間長嘅時候咧，咁佢血咧就會凝聚啦，凝聚嘅時候咧，佢就可能有啲血塊形成啦。咁呢啲血塊咧就由個血管嗰度咁上啦，出咗嚟啦，就上咗個腦嗰度啦。咁呢啲血塊唔係好大嘅喎，可以大啦，但係即係大嘅就喺條頸嗰度塞住。咁啊，呢個係大嘅中風啊。咁咧細嘅咧就上到嚟呢啲細啲嘅血管嗰度。咁呢個咧比較細啲嘅中風。所以咧就算係中風啊。即係好似心臟病咁，有大有細嘅，有啲人心臟病發咗，都唔知道嘅，係有一部分嘅心肌咧，可能係缺血死咗啦。但係因為佢部分太過細咧，個病人冇感覺嘅，係冇症狀嘅。咁亦都係中風咧，就係咁啦。咁佢有啲大嘅症狀咧，就係依啲咁喺啲大血管度塞住啦。哇！依條血管塞咗，全部依邊嘅腦啊都冇血到嘅。啱唔啱啊？咁如果係佢唔喺呢度塞，係上面呢度塞，係塞到尾呢啲咁嘅一啲嘅支柱嘅血管咧，咁佢呢個咪小中風咯。咁亦都可能係自己或者個身體嗰度佢中風一少少時間之後，就係嗰個即係暫時性嘅中風，就係小中風，就係自己會即係嗰啲症狀會走咗咯，即係可能會係咁嘅。咁呢個咧就係喺呢個心房震動嗰度。就係因為佢跳得唔勻循，就形成有血塊，呢啲血塊就上咗個腦，咁就形成中風嘅。
So next, I wanted to include risk factors for the hemorrhagic stroke as well. And so here also high blood pressure can cause blood vessel injury and can cause those blood vessels to rupture, causing a hemorrhagic stroke. Also, there can be abnormal blood vessels that are either weak or tangled, and this could be from birth or from inflammation. And so those can also be different causes for rupture of blood vessels as well. And blood thinners are helpful for treating blood clots, but they also run the risk of causing bleeding or too much of the blood thinning effect and lead to unwanted bleeding in other parts of the body, including the brain. And then also similarly, we have drug use, as described earlier, as another cause that can also affect both ischemic and hemorrhagic stroke.
咁你如果係睇呢度咧，如果你心水清咧，你就發覺咧，呢個出血性中風嘅危險因素裏邊呢4個主要嘅因素啦嚇，有2個係同嗰個塞血嗰個中風一樣嘅喎，邊2個咧？第一個咧就係呢個高血壓啦。第2個咧就係食毒品啦，所以即係食嗰啲白粉啊嗰啲嘢咧，咁咧就會形成個血管裏邊咧，可能係有損傷而令到佢係損傷咗咧，個血管薄咗，個血管個牆薄咗咧，而令到嗰啲血飆出嚟嘅，穿咗咪飆出嚟咯。咁啊高血壓梗係啦，如果你個血管啊，你任何嘅血管。任何乜嘢嘅情形，譬如有啲人撞車咁樣啦，咁撞車咧嗰啲血管嘅牆啊，可能破裂咗，你可能唔知嘅，佢就係咁，即係血管嘅牆有3層啊嘛 ，OK， 一層外層，一層內層，中間有一層，咁佢可能喺內層同埋中間一層嗰度咧，就有啲鬆咗啊，因為個震盪咧撞車嘅時候整鬆咗佢，咁 咁你初嘅時候冇事嘅喎，咁咧因為你鬆咗咧，咁嗰啲血啊咪走咗去嗰啲腸嘅中間嗰度咯。咁咧喺個腸嘅中間嗰度咧，個腸嗰度咧就越嚟越脹啊，好似生咗嚿瘤咁樣樣。咁咧如果你有咁嘅情形啊，你又加上個血壓高咧，咁啊弊啦。咁個血壓高嘅時候咧，咁你個腸啊嗰膜薄咗咧，佢咪如果高得咁上下嘅時候，咪突然間咁爆咯。OK， 或者有時激動嘅時候咁啊，啲血壓高咗，你見好多時睇電影都睇到啦，係咪嗰啲人即係嗌交又好，或者好激氣又好，咁啊突然間咁啊暈咗跌低咗啦，中風咁，然後入醫院死咗。呢啲係即係劇情嚟啦，但係實在喺我哋現實嘅生活之中咧係可以發生嘅。所以有啲人話叫你佢有高血壓嘅，唔好激佢啊咁。你真係唔好激嗰啲有高血壓嘅人，因為唔知發生會咩事。咁呢個咧就係呢個 breath thinning medication 咧，就係呢個稀釋血液嘅藥物。因為有啲人咧有血塊噶嘛，咁啊譬如嗰啲人有正話嗰個心房震動嘅唔正常嘅，佢咧因為佢可能有血塊形成啊嘛，咁嗰啲醫生咧通常係會俾啲稀血藥佢哋食嘅。所以你俾啲稀血藥佢食嘅時候咧，佢如果嗰個腸嗰度又有個缺口咧，咁呢啲稀血藥咧係好可能整到嗰啲即係會穿咗嗰個血管個牆壁，而令到有嗰個脆性嘅中風咯。所以呢啲咧，呢4個原因咧，又係同嗰個缺血性中風嘅原因亦都有啲關係。但係咧，佢又另成一格，就係會整到係爆血管。呢個就係我哋成日所講嘅爆血管中風。
I also wanted to mention other factors that can also increase your risk of stroke, but cannot be really modified. And so that includes older age. If you've had one stroke or one prior transient ischemic attack, we can't undo the fact that it has happened. And so that does increase your risk of future ones. Also, if you have any blood clotting disorders or genetic disorders, we can't change that. And so we want to focus on reducing factors that we do have more control over.
呢啲我哋睇呢個改變呢啲高風險嘅因素嘅時候咧，又好似同心臟咁樣一樣，有啲咧你係改得到嘅，有啲咧你係改唔到嘅。咁呢啲咧就係改唔到嘅嘢啦。第一就係我哋唔可以返老還童，由老變翻後生。第二咧就係如果你曾經中過風，或者曾經有過嗰啲短暫中風、小中風咧，你將來會有一個大中風嘅機會咧，係大大增高嘅，增高幾倍嘅。所以如果你屋企人或者自己都好啦嚇，曾經中過風咧，你就對中風嘅症狀咧，你要特別留意啦。有啲輕微或者手有啲痹啊，或者隻眼有啲開始有啲模糊啊，諸如此類咧，你就唔好等到真係好模糊、真係好清楚嘅時候，你先去揾醫生啦。你就有少少嘅時候咧，你就要特別留意 ，OK， 要去正式咁面對呢個病情，唔好即係以為話唔係嘅，可能唔係嘅，即係有個咁嘅僥倖嘅心態咯。咁咧就有啲人咧就因為有啲凝血嘅病咧，有啲人天生出嚟就即係嗰啲血咧係唔會凝噶啦，咁嗰啲咧就係會或者係好容易凝噶啦，咁所以咧呢啲人咧就係會有食藥嘅。咁咧佢嘅中風嘅情形咧就我哋冇辦法改咧，因為佢有個咁嘅病，咁你係要食呢啲咁嘅藥啊嘛。咁然後咧有啲就係遺傳啦嚇。
So to focus on stroke prevention, it's important to see your primary care doctor to work on achieving the following with either behavior modifications or medications. And specifically, that's to have a normal blood pressure, normal cholesterol levels, and treatment of diabetes if you do have high blood sugar. And if you do have a diagnosis of atrial fibrillation, to discuss with your primary care doctor if blood thinners should be started.
咁呢啲咧就係我哋可以做到嘅預防中風嘅因素啦。所以咧，你哋如果各位在座嘅，如果有血壓高啊，或者有血糖高啊，或者有糖尿病啦，呢個三高啦嚇，血糖、血壓、膽固醇啦，如果有呢個三高嘅咧，請你哋記住要好好保重自己身體，要將呢個三高咧好好地控制好。點樣控制啊？就係你即係正常嘅去揾醫生，每年都要檢查一次啦，或者係佢叫你嘅情況差啲嘅，可能要你3個月檢查一次啊咩？即係你要去度住啲血咯，你唔睇住啲血， 你點知道血糖低唔低、血壓高唔高咩嘢啫係嘛？咁所以咧係要自己好好地保重身體。但係咧睇醫生就睇醫生嗰一剎那啫，平時喺屋企咧。1年365日，你真係365日都係靠自己去保持呢啲嘢嘅正常嘅狀態嘅，所以咧自己對自己身體嘅控制咧係非常之重要嘅。醫生係可以帶領你去做啲啱嘅嘢，但係你要聽醫生話啱唔啱啊？你要睇醫生同埋要聽醫生話。咁咧至於呢個心房震動嘅血液嘅稀釋劑啦，咁如果你係有食呢啲咁嘅藥咧，你就要好乖啦，因為有食呢啲藥咧係有啲嘢係唔食得嘅，你真係唔食得嘅，同埋咧你食嘢嘅份量咧係要好準確嘅，同埋你每個禮拜食啲咩餐啊嗰啲嘢咧，你真係要揾個營養師傾一傾，寫低咗啲嘢，唔好亂咁食嘢，因為亂咁食嘢咧會影響呢個稀血劑嘅功能啊。咁等到你嗰啲血咧，你食嗰啲藥一樣喎，但係佢嘅功能有時高啲，有時低啲咧，咁你嗰啲血咧又有時薄啲，有時咧就容易去整呢啲咁嘅血塊形成嘅。
And besides the prior slides of the medical problems I listed, other behavioral changes that I highly encourage to help reduce stroke risk. One is just to quit smoking, and even if that means starting by just cutting down the amount of cigarettes per day. And then next is exercising regularly, something that gets your heart beating fast. A goal of at least 40 minutes, 3 to 4 times a week would be very helpful. And then weight control to avoid obesity in order to reduce the risk factors of high cholesterol, high blood pressure, diabetes that is associated with having obesity. And then lastly, also a healthy diet, which means low fat, less salt, avoiding large amounts of alcohol are all helpful for things that you're able to do and take control over to reduce your stroke risk.
咁咧當然係有啲嘢你係可以自己做啦，喺行為方面就係要檢點啦。日常嘅飲食係要檢點，係希望你要揀飲擇食。以前就成日俾屋企鬧，細個嗰陣時就你咩都揀飲擇食嘅，依樣又唔食，嗰樣又唔食，其實係好㗎。請你揀飲擇食。咁咧，我哋首先講翻呢個戒煙先啦。如果你係食開煙嘅人士咧，就真係希望你未戒煙嘅即刻去戒煙。如果你自己覺得係戒煙難嘅咧，係有地方可以幫忙你嘅，咁你就同你嘅醫生講一講，揾你嗰個家庭醫生話我想戒煙，但係我戒唔到啊，有咩辦法幫到我？咁個醫生就會同你講解噶啦。第二咧就係運動啦，尤其是 COVID， 我哋真係好多時咧都唔出街，唔夠運動，係咪啊？咁所以咧，孫醫生咧提醒我哋，就係最好咧就係每日可以做40分鐘嘅運動，同埋係一個星期可以做3至4次嘅。咁即係30-40分嘅運動，同埋30-40分鐘嘅運動，同埋一個星期3至4次啦嚇。如果你係唔想出街嘅，咁喺屋企可以做啲，你可以行上行落樓梯都得，或者係買架嗰啲咁嘅腳踏單車咯，喺屋企可以用啊，係咪？咁即係你揾方法去做呢個運動啦。你出唔出街都好咧，如果你最好係可以揾幾個人一齊出街咁樣行，就比較安全啲，係咪？咁咧就另外一個就係體重啦，即係如果係過肥嘅話，咁對身體始終都係唔好嘅。過肥咧會影響你嘅血壓啦、膽固醇啦、糖尿病啊，跟住會帶出好多原因出嚟嘅。咁所以咧，你係要控制你嘅體重。咁講嘅易啊，其實非常之難嘅。咁如果有問題，又係要請你去同你醫生傾下，睇下佢點樣幫到你啦。咁咧飲食健康呢個就係我哋唐人嘅大忌啦，因為成日都食飯嘅，我哋係飯桶嚟嘅嘛。咁飯咧就係我哋好多時一個好大嘅健康嘅危機嚟嘅。咁我而家都少食咗飯，咁希望你可以少食啲啦。叫你完全唔食啊，可能有啲人唔得嘅，但係有啲人都學做到噶啦。咁你就譬如由1碗減到半碗，減到1/4碗，咁你盡量減少啲啦，同埋唔好餐餐食飯啦，或者淨係一餐食啦，係咪？即係好多嘢咧，你係做唔係完全做得到，你都盡量去知道係唔好咧，你係減少啲做，盡量咧就係譬如食多啲菜，食少啲飯，即係呢個又係要自己控制咯，係咪？因為如果你控制唔好咧，你嘅血糖又高啊，糖尿病又失控啊，咁又跟住咧呢啲咁嘅中風呢啲情形咧，心臟病咁啊跟住你嚟噶啦。
And so just to summarize, anyone can have a stroke at any age, but the part that we can take control over is to address our different stroke risk factors and helping to see a primary care doctor to evaluate for these risk factors and making the lifestyle changes, as well as any medications that may be helpful for addressing these risk factors.
咁阿孫醫生嘅總結咧做得好好啊！咁咧因為咧佢係講我哋好多人做唔到嘅嘢，佢係提我哋係即係講出嚟好似好易咁啊，但係非常之難做嘅。但係你哋一定要落個決心去做，好似戒煙咁，講就易啦，兩個字戒煙，做出嚟咧就非常之難，係咪？所以咧，但係我哋嘅總結咧都係提醒大家，呢啲嘢咧係可以幫到我哋嘅，就記住咧係中風咧其實係年紀細嘅時候都有開始嘅，而且中風咧可能有個年輕化嘅趨向嘅，但係咧一般咧就60歲以上，所以各位如果你年紀咧係60歲或者以上嘅時候咧，你就要特別留意呢啲中風嘅症狀啦，因為佢係唔會預先話俾你聽，我下個禮拜你中風噶啦，咁唔會話俾你聽嘅。你係佢嚟到嘅時候咧，你要知道，哇，呢個可能係中風嘅跡象喎，咁我要真係大概1日喎，咁你係要知道嗰個程序啊，你要係即係你個腦嗰度咧，你係要形成咗有個咁嘅方法，知道哇，一有嘅情況，哇唔好等啦，打9一1啦，唔好等邊個仔放工啊，或者個女放工啊嚟車我去醫院啊，千祈唔好做呢樣嘢。第二樣嘢咧就係呢個風險咧，呢啲中風嘅風險因素咧，係會增加中風嘅可能性啦，係咪？咁你如果係知道你自己有咩毛病嘅時候，我所謂嘅毛病咧就係譬如有啲人糖尿病，佢係揀唔到食2碗飯咯，一日。咁如果你知道呢個，咁呢個係毛病啦，你知道呢個係你嘅毛病嚟，咁你揀唔到咧，你就要揾啲嘢去代替佢啦。用咩代替咧？呢個你即係可能要揾啲營養師嚟同你傾下 ，OK？ 咁所以咧，有時啲嘢咧係我哋想做但係做唔到嘅，你一定要知道。咦，呢樣嘢我應該做，我做唔到，我要揾人幫忙。你要知道幾時要揾人幫忙，唔好話自己喺屋企嗰度，我做唔到算啦咁。揾個啱嘅人幫你咧，係會幫到你去改變你一啲改變唔到嘅習慣嘅。咁第三咧就係記住，你有個醫生噶嘛。我哋而家大部分嘅人都有個保健醫生噶嘛。咁你真係即係可能同呢個醫生溝通要好啲，你有咩做唔到嘅，你有咩擔心嘅，你係要揾呢個醫生傾下偈咯。我諗佢都就算而家係呢個有呢個新冠病毒啦，係咪有呢個咁嘅情況，佢都可以喺個電話同你傾偈嘅，或者喺視像嗰度同你傾偈嘅，你未必一定要去佢個 office 嗰度嘅，所以亦都係應該可以容易嘅。We're coming to Q&A， so 各位如果有咩問題，Dr. Suen， 多謝晒 ，Thank you so much， great presentation，
Thank you
for
for
the major points. Thank you.
I guess I just wanted to go back and thank Diana for arranging this and for all the folks involved in getting this off the ground. I should also mention that Lindsay is our stroke navigator at UCSF and is a key stroke educator for patients and our staff, and also helps with the transitions of care from our patients as they move from the inpatient setting to the outpatient setting as well. So with Lindsay and Catherine, thank you so much for these wonderful presentations, and thank you, Diana, for your astute translation.
咁啊，好多謝Dr. Kim 金醫生，咁佢咧就係多謝我啦，亦都多謝佢正話嗰兩位講者嘅。咁佢咧就話Lindsay 咧 ，Lindsay 係一個護士嚟嘅，佢嘅工作咧就係指導嗰啲中咗風嘅病人同埋家屬，佢哋應該做啲咩嘢，教育佢哋應該做咩嘢，同埋佢哋要翻屋企嘅時候點樣安排佢哋。所以Lindsay嘅工作咧係非常非常之重要嘅，喺一個中風嘅情況嚟講啊。咁病人中咗風啦，就入咗嚟醫院啦，咁點咧咁好多嘢會跟住要發生嘅，就係佢哋應該要點做啊？要點樣照顧個病人啊？要食啲咩藥啊？跟住要翻屋企出院嘅時候去邊度啊？翻唔翻屋企咧？因為情況嚴重，係要去另外一個地方去療養咧。咁呢啲通通嘢咧都係喺 Lindsay 一手包辦嘅。咁咧我今日問過佢原來我哋而家UCSF 有20幾個中咗風嘅病人喺醫院嗰度嘅，所以佢嘅工作係非常之繁重嘅。咁啊當然我哋Kim醫生咧就係亦都係多謝Dr. Suen 孫醫生啦，就係多謝佢喺我哋醫院嘅呢個中風團隊之中啊，擔任一個非常之重要嘅部位，去幫助啲病人嘅治理。
I would like to move then to the question and answer. Some of you might have noticed that during the session, I was typing over here on the side, and that's because there's already been a few questions that have been asked. So one question was, how do you differentiate between a stroke and something called Bell's palsy?
個問題咧就係話有一個症狀咧叫 Bell's palsy 嚇，即係一邊面一部分嘅面肌肉咧係癱咗嘅。咁咧呢個 Bell's palsy 咧就係有喺呢個新冠病情之中咧，有啲人係有呢個症狀發生嘅。佢話個問題咧就話你點樣分啊？你話一邊面癱咗唔喐，咁又係中風，咁但係 Bell's palsy 喺新冠嘅病情之中有可能有出現嘅喎，咁你點樣分係咪中風啊？咁呢個就係個問題。
So, I mean, I could answer it briefly saying that they look similar and they typically involve one half of the face, but a neurologist can usually distinguish between the two very readily. But both require early treatment and both should be evaluated by medical attention.
Should they go to their primary care first?
Well, the problem is I don't want folks diagnosing themselves. And if they could be a stroke, it's still okay to call 911. If you think it's a stroke, it's okay to call 911. And if you make a mistake and you think it's a Bell's palsy when it turns out to be a stroke, that could be an opportunity to treat stroke that's missed.
呢個係一個非常之好嘅答案。咁當你唔知道嘅時候咧，好啦，你而家一邊面癱咗，即係你覺得係一邊，即係兩邊面唔對稱啦。OK， 簡單嚟講就係，當你發覺有一個問題嘅時候，你又唔知係咪因為嗰個新冠嘅病情啦咁樣樣，因為係中風喎。咁你點咧？你係到底係打電話俾醫生啦，因為打電話去醫院個急症室咧？咁Dr. Kim 咧，其實佢嘅意思咧就話，你咧就唔好自己去估，你又唔係醫生，你亦都唔可以自己去做呢個判斷，你就去打個電話俾急症室，咁就比較安全啦。咁咧，假如講係中風嘅時候咧，就唔會阻遲咗我哋對你嘅治療嘅延誤，因為你即4個半鐘頭嘅啫，所以你過咗呢個黃金時間咧，我哋係唔可以俾嗰啲稀血藥你咯。所以個答案係打電話去急症室，去醫院。
Symptom differences between small and major strokes, similar or different intervention. In small strokes, is time difference between detection and treatment intervention important? So small and major strokes, well, any stroke can be serious. And the size of a stroke, if it's in the right place, can cause very severe symptoms. And so I think of all strokes as a important thing to address and treat. And even so-called small strokes can benefit from early treatment. So I don't make a big distinction between small and major strokes. A small stroke can become a major stroke, and we don't want to miss, again, any opportunities to treat.
Here's the thing, in Chinese, we call the TIA, the translation is called a small stroke. So it's actually a mistranslated item. But I don't know if the person who wrote this question means that it's a difference in symptoms between a TIA as versus a real stroke, or that it's really talking about a big stroke as in a carotid, blockage, or a terminal cerebral artery blockage, that kind of big and small stroke. It could be both, right?
Yeah. Both benefit from early treatment, both benefit from urgent evaluation. And in fact, there's a movement amongst neurologists to even move away from the term TIA because it is an emergency. And in some ways, TIA is just as urgent as a stroke because the risk of a stroke after a TIA is very high. And that's the perfect opportunity to prevent a larger stroke before it can happen. So it's very important to be evaluated even if the symptoms go away.
佢話大中風、小中風、中中風，乜嘢嘅中風都好啦。總之，如果係中風嘅咧，就我哋一定要做兩件事。第一咧就係嚴重咁樣去處理佢，好嚴正咁去處理佢，千祈唔好話可能的咁多啫，可能少少啲麻痹啫，可能唔係乜。你要嚴重咁樣正視佢，唔好有個僥倖嘅心態，亦都係要知道咧，大中風同小中風嘅症狀咧，都可能係 會引起好大嘅問題嘅。咁第二咧就係要趁早及早治療。呢個及早治療呢個時間呢方面咧，我哋曾經講過，時間就係我哋嘅腦細胞。OK，time is our brain cells。咁你如果時間越耐嘅時候咧，呢個中風咧就係會越長啦，多啲腦細胞咧就會死亡。個中風咧就個後果咧就更加難處理，咁咧就係好難，即係個復原啊，復原會耐啲嘅。所以你如果係及早處理咧，嗰個中風嘅後症狀咧就係會可能係快啲可以復原嘅。咁所以咧，我哋係要盡量係要當佢係一個好重要嘅症狀去處理咯，唔好理佢大細咯，或者理佢係短暫又好長又好啦。其實有一樣嘢咧，就係佢話呢個 TIA 啊 ，Transient Ischemic Attack 呢個所謂嘅短暫嘅小中風呢個症狀咧，佢話而家咧有一個趨勢啊，喺佢哋腦科嗰度有個趨勢咧，就係唔再叫呢個做 TIA， 因為而家發覺咧呢個 TIA 咧呢個小中風啊，係一個非常之有利嘅時間咧，係俾我哋去正視呢個咁嘅問題咧，係要好嚴正咁樣去處理，就當佢係中風呢件事，就要俾啲稀血藥病人食啊，或者叫佢做啲咩行為嘅改變啊，或者戒煙諸如此類。呢個係一個好重要嘅時刻嚟嘅。如果我哋唔當佢係一回事咧，而俾個病人就咁翻屋企咧，呢個係我哋係失策啦，變咗係。咁咧 ，and Dr. Kim, there's actually many cases I've heard multiple people telling me that they went to the emergency room with a TIA. So obviously they had the symptoms when they go in. And then while they were there, the symptoms left and disappeared. And so then the people in the emergency room would say, okay, I guess you can go home now since you don't have the symptoms anymore. So what do you think about situations like this?
No, the risk of a stroke after a TIA is approaching 10%. 10% within 3 months, and half of that risk is within the first couple of days. And so it is an emergency, and we can treat it and prevent more than 80% of the subsequent strokes. So it's a perfect opportunity to prevent a stroke. So even if the symptoms go away, there's still a risk for developing the larger stroke, especially in the first hours and days.
What would you say that if this is your father and you're just a patient, not a doctor, and you're in the emergency room and the staff is saying, okay, now you can go home now. What is the best thing to do?
I think it's to advocate for the fact that these symptoms are serious and involvement of a
nurses, right?
Well, I mean, and also, you know, the involvement of a neurologist who is familiar with these risks and these interventions to reduce the risk of stroke is very important, because yes, it was different, 15, 20 years ago when we didn't have the evidence to support what we do now. And even neurologists were more complacent, but there is study after study after study showing how high the risk is and how we can reduce that risk with our treatments. So
should they insist on seeing a neurologist before they leave? You just say to the people in the emergency room, say, well, I'm not leaving until I get to see a neurologist.
Yeah. Well, maybe I can turn it around and I can say that there's a relationship between UCSF and Chinese hospital, whereby UCSF neurologists are available to evaluate patients in the emergency department using this a very similar video system. And so you would have access to neurology specialists that have familiarity with TIA. And so I think that's an important component of the care that's available at both institutions.
So let me clarify, I have no inference to Chinese hospital at all. And the patients that were telling me, they were not patients that went to Chinese hospital. They actually went to other hospitals, to tell you the truth. So it's not a unique situation I guess it's not a unique situation to any hospital. So let me translate a little bit from what you say first before I lose it, because we talk about a lot of things. So 金醫生咧就係話咧，呢啲咁嘅短暫嘅中風啲症狀啊，就算係走咗症狀係冇咗啦，喺個急症室嗰度，佢話咧呢啲咁嘅病人咧，佢有中風嘅機會啊，有一個大中風嘅機會咧，係 50%啊，2日之內有一個大中風嘅機會係有50%嘅。咁就算係2日之內冇咧，喺3個月之內啊，佢有呢個中風嘅機會咧係有1成嘅。咁即係話咧，呢啲病人雖然入嚟嘅情況咧係有啲短暫性嘅中風嘅症狀，而啲症狀咧又係冇咗啦。但係如果係我哋唔做嘢，唔俾藥佢食，唔同佢做啲控制嘅嘢嘅情況嘅時候咧，佢跟住有中風嘅機會咧係大大增加嘅。所以大家咧就唔好掉以輕心。咁咧，咁我就話咁你我哋話啫，我哋知道啫。但係有時嗰啲你入到去急症室嗰啲人真係叫你走嘅喎，急症室咁多病人，你話係咪？尤其是而家呢個咁嘅有呢個病毒啦，新冠肺炎呢個情況啦，咁佢話叫你翻屋企。咁你應該係好開心翻屋企，咁你要點做咧？咁金醫生咧就話，其實最好咧就係應該有個腦科專科，屬於啲短暫中風啊或者中風呢啲咁嘅專科人士咧，專科醫生咧嚟同你睇一睇先嘅，同你睇睇先咧就唔會走咗雞啊！即係我哋跟住走咗雞一個咁好嘅機會嚟到可以從你防止一個大中風嘅機會。咁所以咧，呢個係一個非常非常重要嘅環節嚟嘅，大家請你聽清楚。你係就算佢叫你走，如果你有呢種症狀，有個一邊眼睇唔到嘢，或者個身體弱，或者係隻手揈揈下嗰啲咁嘅，即係好弱嘅症狀咧，你係要同嗰啲醫生講啊，我驚住我真係有呢個短暫中風。可唔可以叫個盧醫生嚟同我睇一睇？咁我哋咧就因為同東華醫院嗰度係有呢個咁嘅聯繫咧，有個合作嘅項目啦，就係東華醫院咧，就算嗰啲醫生如果有咩問題咧，佢哋係會打電話同我哋嘅腦科嘅醫生嚟到講嘅，所以你係有一個好大嘅保障嘅。咁咧就其他醫院我就唔知道啦嚇。咁咧就但係你哋自己都要做一個醒目嘅病人咯，就唔好話人哋叫你走你就話啊好開心可以翻屋企，唔好開心得咁快字，可能呢個係一個好嘅機會嚟到防止你一個大中風嘅。
There's another question that I just answered about the Bell's palsy and facial weakness. So the question was, should you demand a CT scan? Let me be clear. Most physicians, if they examine you, can distinguish it between a stroke and Bell's palsy, and so usually a CT scan isn't required to make that determination. Also, some strokes, especially early on, can't be seen very easily on a CT scan anyway. And so if it really is Bell's palsy, a CT scan isn't necessary.
另外一位朋友咧就話，咁係咪要用嗰啲電腦啊？CT scan 係叫做乜嘢？電腦嘅，即係去做一個電腦嘅切片嘅影像嘅照好似 X-ray 咁樣，但係佢唔係 X-ray 嚟嘅，佢好多層嘅 ，OK， 斷層嘅 X 光嘅影像嘅即係做呢個照片啦。咁咧，金醫生咧就係話，佢話咧，就算係中風咧，初開始中風嘅時候咧，呢個 CT scan 咧都唔係一個好嘅方法去睇呢個中風嘅情況嘅。So they usually use an MRI, right, Dr. Kim?
Again, it depends on the clinical situation, what type of imaging is used. Both CT scans and MRI scans are sometimes used in evaluation, but the situation is can be varied.
So if a stroke patient comes in, do you order an MRI or CT?
So if it depends on the situation. If the question is determining whether the patient can receive that IV TPA or the thrombectomy, the test that we usually get is a CT scan, not an MRI, because the purpose of the CT scan is not to see the stroke, it's to make sure it's not from bleeding. And that can be readily determined very quickly within minutes of arrival on a CT scan. And actually that leads into one of the questions that we have in the Q&A about how do ED doctors determine whether a stroke is caused by a clot or a ruptured vessel. And I think Catherine was responding to that, if you want to take that.
Yeah, just to answer that question. So like Dr. Kim was saying, ER doctors will first evaluate if symptoms are consistent with a stroke. And then if they are concerned for a stroke, they'll order a CT scan in the emergency department, and that will show, it'll look a certain way on the scan that will help identify fresh blood, and that will help us distinguish between a hemorrhagic stroke or blood in the brain versus maybe some other cause for their symptoms, whether it's an ischemic stroke or some other neurologic problem.
多謝孫醫生同金醫生。咁咧就係個問題咧，初嘅時候咧就係話有 Bell's palsy 同埋嗰個呢個中風嗰度開始嘅，就係話咁如果唔知道係 Bell's palsy 因為中風咧，咁係咪用個 CT scan 咧就可以查到啊咁樣樣？咁呢個答案咧，當時Dr. Kim 咧就係話依個都唔係一定查到嘅，因為初啲中風咧未必查到。咁啊點解佢哋如果係嗰啲病人有中風嘅症狀啊，入咗去急症室之後，佢哋會 order 呢個 CT scan 咧？呢個 CT scan 嘅用途咧？即係用呢個斷層照 X 光呢個用途咧，就係要嚟幫佢哋去睇下嗰個腦有冇出血嘅，係咪中風有嚿血塊咧就未必睇到，因為嗰個血塊可能好細嘅，或者個切面咧係睇唔到嘅，唔清楚嘅。咁但係咧係咪出血咧？出血就一定睇到啦。咁咧因為咧佢如果個病人嗰啲症狀係有晒中風嘅症狀啦，我哋係唔需要靠呢啲圖片啊去做呢個決定係佢係咪中風嘅，我哋喺個症狀嗰度咧，我哋係可以大概知道佢係好可能係中風。咁然後咧，我哋跟住要即刻做嘢啦。做咩嘢咧？因為你如果係缺血同埋爆血管係兩個唔同嘅事嚟噶嘛，你見到嗰啲做嘅方法咧係唔同噶嘛。咁你當然係你有血塊嘅時候，你就俾啲稀血藥佢。但係如果佢出血嘅時候，你梗係唔會俾啲稀血藥佢啦，係咪？所以咧，呢個咧就決定會唔會俾呢個稀血藥佢，即刻俾個稀血藥佢。因為我哋有個時間限制係4個半鐘頭啊。OK， 咁我哋就要喺呢個短嘅時間之內要決定佢到底係塞血咧、塞血管啦，因為係出血爆血管咧。如果佢係爆血管嘅，我哋唔俾稀血藥佢。OK， 做第二樣嘢就要做手術啦。如果係因為有嚿血塊塞住咗個血管 ，OK 係塞血管嘅，咁我哋咧就可以俾稀血藥佢。咁到底俾唔俾稀血藥咧？就係靠呢個做呢個 CT scan 照呢個斷層嘅 X 光嚟到去決定啦。即係我哋如果佢係爆血管，我哋睇到佢爆血管，並唔係話因為睇到佢中風。
There's a question here about do I advise checking carotid artery with ultrasound or no need unless high risk? So the carotid artery supplies the brain, the eye as well, and it absolutely is part of a workup for someone who's having symptoms of a stroke or TIA. So it's most helpful in that situation. It's much less helpful when someone's not having any symptoms and is just being screened to see if they might have narrowing without symptoms, because the chance of that that's the case is much lower unless you have a lot of risk factors. So I think, again, most helpful for symptomatic patients, less helpful if there's no symptoms or if there's not any high risk factors.
咁呢個用超音波去查血管呢件事咧，其實 So I did some screening a few years ago for carotid artery ultrasound as a screening tool, just in general for the public. And we found maybe 1 out of a few hundred. So the chance of finding anyone is really low. 所以咧，金醫生咧就係話，如果你用呢個超音波咧去查呢個血管個頸嗰度嗰兩條大血管啊，睇佢有冇塞㗎啦。佢話咧，如果係冇症狀嘅情形之下咧，你揾到佢出嚟嘅情況咧，應該唔係咁高嘅，嗰個比率唔係咁高嘅。但係如果你有症狀嘅時候咧，咁又唔同啦，就可能揾到個不正常嘅情況嘅時候咧，係可能會高啲啦。咁所以就係睇下佢有冇症狀嘅時候嚟決定呢個用超音波查呢個血管有冇用咯。
This is also because the benefits of treating a narrow carotid are less certain if it's not causing symptoms.
咁仲有一樣嘢咧，就係佢話，如果嗰條血管啊，就算佢係窄咗，即係可能有少部分嘅地方塞咗，但係你知嗰條血管好粗噶嘛，咁如果佢塞咗少少嘅時候咧，佢話你就算而家同佢通咧，佢即係個效果係即係唔係好顯著咯，所以就算係查到都可能係未必有用，因為佢哋都唔會做嘢，通常係要塞咗7-8成啊咁先同你做嘢嘅，通常就好似個心臟咁樣，啲血管好多時都塞塞地噶啦，但係佢唔到塞到7-8成啊，佢啲血一樣可以流過，一樣係夠血去供應其他嘅心臟嘅肌肉噶嘛，所以佢係唔會同你做嘢字嘅，係唔可以添啊，係個驗疏唔會俾佢同你做任何嘅嘢，因為佢唔俾錢嘅。
Maybe I'd invite Lindsay to see a question that came in that might be you might be able to address. It's asking about depression after suffering a stroke and what support and services are available for stroke survivors and family members.
Yeah. Hi. So actually depression is pretty common after a stroke. It can either be due to some chemical changes within the brain or just the fact that this is a major life event and that some mobility has been taken away due to some of the disabilities from the stroke. We do have a neuro resource guide on our website. I'll actually post it in the chat that provides patients and their families different resources. They are national and local that provide different services for stroke patients and their families. And it ranges anywhere from different support groups for patients that are experiencing stroke or family members that would like a support group, all the way to different rehab services that are offered within the Bay Area and in the peninsula. As for your brother, I know he's in Virginia, and I'm from North Carolina, so I very much understand rural Virginia and the rural south of the Appalachian. So getting access to healthcare or healthcare resources can be really difficult. But I definitely encourage him and the family that is out there to reach out to those sources and to try to get involved with community organizations, even a support group or an online support group, to kind of help talk with other individuals that have gone through the same thing.
正話一條問題咧，就係問話，如果中咗風嘅病人咧，好多時咧有啲憂鬱症，咁我哋係成日都見到㗎啦呢樣嘢。咁佢話有啲咩嘢有啲咩資源喺個社會嗰度可以幫到佢哋啊？咁真係呢個資源問題係一個非常之重要嘅問題啦，唔係話就咁中咗風啊點啊？咁中咗風都要復原㗎嘛，咁但係復原之中有憂鬱症咁啊，復原嘅過程咪慢咗咯，係咪？咁所以咧呢啲情況咧都係要幫佢哋嘅。咁阿 Lindsay 咧就係最叻呢樣嘢㗎，佢擺咗嗰個 Q&A 問答嗰個 box 嗰度啊，你哋將佢抄咗出嚟咧，呢個咧就係無論你係個病人喺邊度，家屬喺邊度咧，佢對病人或者家屬咧都可以有一啲支援嘅。係可以資訊方面啊，或者係介紹你轉介啊，諸如此類，佢都有幫助嘅。咁你哋將呢個網址抄低咗佢，咁你咧就可以到時如果有必要嘅時候咧，你就可以用啦。
So we received a question, and the question was, taking aspirin 81 milligrams or a baby aspirin has been discouraged by the CDC for patients with arrhythmia or irregular heartbeats. Should we disregard this warning and continue taking aspirin? I think this is a really important, great question. And, taking aspirin without a specific medical reason is not currently recommended. However, there's different reasons for someone to take a baby aspirin, whether that's related to the heart or related to the brain for what we call prevention of some sort of complication from some other condition they may have, whether that is blockage of vessels in the heart or blockage of vessels in the brain. There's different reasons that someone might need aspirin. And so I think it's important to talk with your primary care doctor, your heart doctor, or your neurologist, whoever started the aspirin, to talk whether or not it's still indicated.
食阿士匹靈呢個藥咧， 食一個 BB 嘅份量嘅阿士匹靈嘅藥咧，好似係好小事咁。咁咧有啲人咧就睇到有一啲介紹咧就話如果冇事嘅唔好食呢啲藥啦，因為始終咧佢都有啲稀血嘅成分嘅，有個稀血嘅作用喺度嘅。咁所以咧嗰啲人咧就話你唔好亂咁食啊！如果你冇事嘅時候唔好食啦。如果係你自己唔好自己去食。咁咧，但係如果係個醫生俾你食開嘅咧，你亦都唔好自己停咯。咁孫醫生咧就係叫你，如果你係醫生俾你食開嘅啦，俾係心臟醫生又好，腦科嘅醫生俾你食又好，或者甚至你嘅家庭醫生俾你食都好啦。總之任何醫生開嘅藥俾你咧，你覺得你唔想食啦，你就一定要同佢講一講先。呢個其實係一個好大問題嚟嘅。你任何嘅藥咧，你都唔應該自己停咗佢，唔話俾醫生聽嘅。你要停一隻藥，你就同個醫生商量下，大家有傾有講，睇下我真係唔係幾中意食呢隻藥，因為我食咗之後有啲咩嘅副作用，咁你總之係咩嘅原因都好啦，你同你嘅醫生傾下 ，OK， 當咗佢係你嘅最好嘅朋友，咁咧同佢傾下，我可唔可以停唔食呢隻藥啊？或者可唔可以用另外一隻藥嚟代替？因為我有呢啲咁嘅副作用，令到我好唔妥喎，呢樣嘢我救得左手又救唔到右手，咁即係有啲咁嘅副作用咯。咁所以咧。就如果係有咁嘅情況咧，大家記住，千祈唔好自己去停藥食，亦都唔好自己去開始藥食，唔好以為話，咦唔係喎，隔離個二叔婆佢中個風，咁你之後翻到嚟屋企咧，咁個醫生俾咗啲咁嘅 BB aspirin，每日叫佢食一粒，我都唔想中風啊，我都去食一粒啦咁，千祈唔好做呢啲咁嘅嘢。唔係話隔離二叔婆食嗰啲嘢咧，你又可以照食，唔係佢嘅飯香啲，你又可以一樣過去同佢食嘅，唔好咁樣。你亦都唔好將你嘅藥去分俾其他人食，唔好懶叻咁樣就話，我邊個中咗風喎？佢而家食緊嘢藥喎，佢好大樽啫，我分一半俾你啊，你可以開始試少少，千祈唔好扮醫生咯。千祈唔好以為自己識少少咁就去扮代表去做醫生，咁就去分啲藥俾人食。所以分藥俾人食又唔得，你要自己好小心啦。我就算係自己做護士咧，我都唔會亂咁開口去介紹病人食藥嘅。So first of all, I want to thank all of you for staying here. So I want to thank Dr. Anthony Kim, Catherine, and Lindsay to be our panelists today and gave us such great advice and great slides. Thank you for all your time preparing for the lecture as well as the time today, taking time out of your busy schedule to come and join us. 我哋係好多謝孫醫生、金醫生同埋Lindsay 三位嚟到今日同我哋做呢個講座嘅。咁我哋亦都多謝各位嚟到今日參加我哋嘅講座啦，係非常之高興你哋喺度。咁我哋咧亦都係多謝我哋嗰個喺背後後邊默默耕耘同我哋做嘢嘅人啦，就係Clifford 同埋 Raymond 啦 ，and they are always here. So we want to thank our technical support in the background for Clifford and Raymond. If you want to get our emails, and we have a lot of information in our emails, regular newsletter, you just write us ahi@ucsf.edu and just write, please add me to your email. Okay, listen. 咁你哋未註冊嘅咧，就請你註冊啦，就係呢個網址 ahi.ucsf.edu。咁如果你哋想加入我哋嘅電郵咧，亦都可以寫信俾我哋，係寫個電郵俾我哋係 ahi@ucsf.edu。咁我哋就會加你入我哋嘅電郵嗰度，等你可以收到我哋通常都充滿資料嘅電郵嘅報告嘅。咁就多謝各位參加，咁下個星期再見啦，拜拜。And thank you again, Dr. Kim, Dr. Suen, and Lindsay. Bye-bye.